Good afternoon. Assalamu alaikum and Ramadan Kareem to all of you who are with us today. I want to welcome you in this information session about the 7th cycle of the precision medicine call that's launched jointly between Qatar Research Development and Innovation Council and Qatar Genome. My name is Sadim Jawhar. I'm a research program manager at QRDI Council. I'm very happy to be giving this presentation together with our partners from QGP, Dr. Hamdi Mbarak, Research Partnerships Manager, and shortly Dr. Saeed Ismail will join us, Senior Director of Qatar Genome Program. I'm also pleased to have with us from QRDI Council, Dr. Muhammad Jarrar, Senior Biomedical and Health Experts. For today's information session, we will be speaking about the objectives and the research priority areas of the cycle, also shedding the light on the available resources at Qatar Genome Program and Qatar Biobank. Then we'll move to speak about the application requirements and the parameters, followed by the submission and evaluation process. The timeline, and at the end of our information session, we'll have a time slot for questions and answers. So if you have any question, please type it in the Q&A box that you see on your screen, and we'll go through it by the end of this presentation. Now I want to invite Dr. Hamdi to tell us about the objectives, research areas, and the resources as well. Dr. Hamdi.
Dr. Said is joining.
Dr. Said is with us. He's muted.
Go ahead, Hamdi. I'm here.
Okay. Good morning. Assalamu alaikum. My name is Hamdi, and I will be going with you around the objectives and research priorities for this call, the 7th cycles, and it's always a pleasure to see as many of you interested to submit for this call. So the objective are around 4 to 5 objectives here. So the main aim of this call is to support the community to implement research and to translate their findings into real implementations project and translational work. This is for to have effective prevention, diagnosis, and the treatment. So what we want here is to see projects that take the research from bench to bedside for, as I said, a more effective prevention, diagnosis, and treatment. And in this way, with this call, we want to provide data and funds in order to support the genomic research in Qatar, and particularly utilizing the resources that are generated by Qatar Biobank and Qatar Genome together with our partners. So to focus on projects that are expected to have a direct clinical impact, this is the main topic of this call, and to address also community engagement and the required policies of such implementation into the clinic. So, and finally is to reach a wider clinical research community and to attract more competitive proposal with a potential impact and real outcomes within the clinical settings. Next, please. So, what are the disease area or the health challenges here in Qatar are not very different from other parts of the world, but we want to focus more on the high prevalence of congenital disorder, given the high consanguinity in the country. Diabetes is one of the main disease that we want to tackle, cardiovascular disease also, and all other disorders that have a significant impact on the years of life lost for the population. Example, cancer, obesity, neurological disorder, mental disorder, maternal and child health illnesses. So we designed the call into around 5 research priorities areas. The first one is under the umbrella of artificial intelligence technology solutions and precision medicine. And we included here some examples, but not limited to this one. It could be application of artificial intelligence for analyzing the imaging data that we provide as part of the Qatar Biobank resources. For example, we have MRI data, we have IDEXA imaging in order to facilitate the diagnosis and treatment planning. Example also include the health informatics implementation in the healthcare system to improve the acquisition, storage, and processing of the data for both patient and clinical perspective. The integration of omics data into the electronic health record, and this is very important nowadays to be able to record linkage with the genomic data with the Cerner data or the medical record data. Development of bioinformatics tools and clinical interpretation solutions for the use of genomics and other omics data. Also, the innovative precision medicine clinical research designs and technologies such as the digital tools, the wearables, the sensors, the medical record analytics. All this are included under this research priority, and as a potential outcome, we want to see new solutions that will facilitate and enhance the handling of this healthcare data and research data for clinical purposes. Next, please. The second research area, priority area is entitled Community Engagement, Ethics, Policies, and Implementation Strategies in Precision Medicine. And examples include like behavioral analysis, research of awareness campaigns targeting public attitude towards precision medicine, identifying the best practice of precision medicine policies and delineating the best regulatory, social, and ethical considerations to implement genomic and other omics technology, identifying the effective strategies to engage with the public and the non-specialist in the healthcare area, addressing also the social and biological inequalities, which may influence the development of such implementation, and systematic investigation of facilitator and barriers of the integration of precision medicine. And as potential impact can be summarized that we want to see projects that can empower patients, researchers, and healthcare providers to work all together in developing new strategies, best practice, and policies in precision medicine. Next, please. The third research area is called disease risk stratification in population groups, and this is also, we have seen a lot of application in this thematic last year. This includes large-scale, local, and also regional cohort are encouraged to apply here to build such large-scale data. And it can include longitudinal dynamics of disease, for example, looking at stratified medicine, intervention, prevention, early flagging of pre-disease states for the individuals that are at high risk, and also utilizing the added advantage of a deep phenotyping approach for patient samples in the biobank and biorepositories. And I will tell you more about the resources that are available in Qatar Biobank, which could facilitate such areas. And finally, a social gene environmental determinant of health. And this we are seeing now more and more research into this topic about the gene environment interaction and social determinants of health as well. So the potential impacts are personalized health applications, programs, and protocols aiming at categorization and stratification of the disease, as I said, in the large cohort that can be locally and also with regional collaborators. Number 4 is the integration of genomics and other omics into clinical diagnosis. And since this, we encourage to have projects that are designed towards more translational, more implementation. We want to see a project that integrates all these tools and all the resources that are available, which are genotyping data, low pass sequencing, whole genome sequencing, or whole exome sequencing, profiling, proteome analysis, and all other omics technologies. So the proposal can also address applicable workflows and pipelines within the target clinical settings and suggest a practical and useful framework and cost-effective approach that facilitates such use of the data. Potential outcomes can extend beyond disease diagnosis to provide clinicians and patients with evidence-based disease prediction tools to empower early intervention programs. The final research area apparatus is pharmacogenomics from and the cycle we called pharmacogenomics from discovery to implementations. And needless to say that pharmacogenomics is one of the pillars of precision medicine implementations. And examples here can include looking at the genetic variation that cause adverse reactions for the medication that were commonly described in Qatar, looking also at the drug response and safety for the cancer therapeutics, also cardiovascular disease and anticoagulation therapies, looking at targeted inflammatory therapies for inflammatory and autoimmune disease. All projects related to pharmacogenomics, pharmacomicrobiomics, and other omics studies. The potential outcomes of such projects focus on providing patients with the opportunity to receive more effective and more personalized treatment interventions with a less effect size. Next, please. So now talk more about our resources at Qatar Genome and Qatar Biobank. We will provide researchers with comprehensive data going from omics data, like the genomic data, the whole genome sequence. We have now over 30,000 whole genome sequence of the Qatari participants and long-term residents in the biobank. We do have also phenotypic data, epigenomic data, and other omics data. This cycle we will also providing EMR data linked to the participants that for whom we have sequence data and omics data, as well as biological samples and imaging data, as we mentioned earlier. Next, please. So this data will be given for free, so please do not budget for the cost of including this data or using this data. However, there might be some cost related to the using the biological samples, and we strongly encourage you to get in touch with the biobank to know in advance how much does it cost to have the biological specimens. We will be providing you with a supporting letter to add it to your proposal, but we strongly also encourage you to get in touch with the research office, Qatar Biobank Research Office, to know more about the numbers for your project, if there is enough numbers to support your proposal, your application. So, and for that, there is a query in the biobank portal where you can submit the questions and get details about, or get an idea about the sample size that is available for your projects. So as I said, we'll be giving you a supporting letter. You will be filling the access application form, and once approved, you will have to sign the MTA for data sharing.
Thank you so much, Dr. Hamdi. If there are any questions from our audience about the resources, we'll be able to answer them by the end of this information session. Thank you. And now we will be speaking about the applications. So for the PPM call, there are two types of application. The first one includes new and this covers proposals that are being submitted for the first time in the PPM call, or proposals that were submitted previously in the PPM but did not pass screening. In this case, they are submitted as a new proposals. The second type of application are resubmission. And these include proposals that were submitted in the previous cycle of the PPM, meaning in PPM 6, it passed screening, went to the review, but was not awarded. So in this case, the lead PI can submit it again in this cycle, only one time in this cycle, flag it as a resubmission in the system and fill in the rebuttal section in the research plan, as well as highlighting the changes that have been introduced in the research plan in response to the feedback received for the previous proposal. We'll speak now about the eligibility of the institution, and for the submitting institution, which is the institution of the lead principal investigator who submits the proposal. It can be academic, public, private, or any other type of entity in Qatar that has a QRDI approved research office. This institution can collaborate with other institutions either inside or outside Qatar, given that these collaborative institutions include at least one principal investigator in the team of the PPM proposal. The lead principal investigator, the lead PI, is the individual who's leading the team and who's submitting the proposal on behalf of the team. The lead PI must be a full-time affiliate of an approved submitting institution and has a terminal degree, research-oriented terminal degree as defined in the list of terminal degrees. You will find them on the QRDI webpage under the document library. The lead PI can submit only one application per cycle, and the total number of participation on all ongoing PPM cycles is 3. This excludes any project that would finish before 1st of October 2024. So for example, if you have been a lead PI in a previous PPM, you still have 2 free roles to utilize in this cycle. You can be lead PI on one project, PI on another project, or for example, use both of them as a PI. The principal investigator also has to be a full-time affiliate to the submitting institution itself or another collaborative institution inside or outside Qatar, and must hold at least a university postgraduate degree and have a suitable experience that's relevant to the work allocated for him or her in the PPM proposal. Other research team members can include postdoc, research assistants or associates, undergraduate student, graduate student, lab technicians, engineers. These, if their information are not available in the pre-award stage at the submission, that's fine. They are listed under unnamed role, so you can only enter general information about their affiliation, their role, and their number. And when the proposal gets awarded in the post-award stage, you can fill in their information. But if it's available at the beginning, that's also fine. The project can include consultants who are individuals with expertise in certain area that can give an advice on a problem or how to tackle certain issue. They should not be involved directly in designing or executing the work. And thus, they cannot be compensated from the PPM research call funds. And also their participation in the project, you have to provide justification for their role in the project. The budget, which is a very important aspect, the PPM gives up to 800,000 Qatari riyal per year, which is around $219,000 per year for up to 3 years. The budget includes direct costs that cover personnel, equipment, travel. That's up to 10% of the annual direct budget. The miscellaneous can be up to 5% of the annual direct budget. In addition to that, indirect costs, that's up to 10% of the annual direct budget. Here I want to encourage our researchers to visit QRDI portal under the infrastructure tab, where you can have access to the available equipment that have been funded by QRDI or by external resources and are available in entities in Qatar. So you'll find information, if you search, you'll find information about this equipment. You can get in touch with the focal point and coordinate on utilizing this equipment. So this would help you optimize the use of the budget by using something that's already available, and also make better sustainability of the funds in general. For the grant allocation, 80% of the annual budget must be spent inside Qatar, and for the effort, 65% of the proposed funded efforts, research effort, must be conducted inside Qatar. As a general rule, private institutions are not eligible for personnel and indirect costs. So please, when you're writing your budget on the system, keep in mind this points. We highly encourage co-funding and cost sharing and the PPM call. For the submission of the proposals, the lead principal investigator, as well as the principal investigators and consultants, need to have a profile on the QRDI portal. So it's oss.qgrants.org. You go to this link and create your own profile. If you already have one, please make sure that you update it, that the CV is updated, and so on. This is very important. As we said, the lead principal investigator is the one who's going to be submitting the proposal on behalf of the team. So after creating your own profile, you'll go to the pre-award tab that you see here on the screen, and then click on start proposal, where you'll be seeing all the available and open calls at the time being. Select PPM, and then you start your proposal registration. At this stage, you'll be entering general information about your proposal, and when you finish the registration, you will get a unique number for your project or your proposal that will be used in the pre-award, and if you're awarded, this is going to be your proposal project number for the post-award phase. After that, you can proceed to the proposal preparation. There are several sections, as you can see here at the left column, to be filled about the proposal. I'll go briefly around them. The proposal summary, brief summary about the work that's going to be done, the impact, the objectives, and so on. The research focus, meaning you have to select the research priority areas that we have just presented, select which one is the research area of the call, of the proposal. If you have more than one research area, you have to flag one of them as the primary research area. Then enter the information about the collaborative institution. So if you're collaborating with another institution, enter the information here and make sure that you're uploading a supporting letter, in which you will find the template for this letter on the PPM webpage. Also enter the information of the personnel, and here I want to highlight for the PIs and the consultants, please use the same email that they are utilizing for their QRDI profile account. Once you enter their emails, they will receive a participation request. So they need to log into their accounts and accept the participation request. So they have to go to pre-award. This is the drop-down menu, and from the participation request, they have to accept your invitation. This is very important because if they do not participate, you will not be able to complete your proposal and you will not be able to submit it. And also here you can enter the information of the other research team members. You have to upload the research plan, enter the information on the co-funding, cost sharing, if any, and use the commitment letter template that's available also on the document library on our webpage. I'm highlighting here the joint funder support because if you're going to use the QBB and QGP samples, like what Dr. Hamdi have informed us, you need to upload a supporting letter that's issued by QBB QGP. So this letter goes here with some information about the type of the support that's provided. In the previous cycle, we used to ask the applicant to upload it under the miscellaneous documents, but I think it's better, it was decided that it's better to streamline the process and make it less complicated and upload it under the joint funder support. Then you have the budget, ethical compliance, if you're using any human subject, animal subjects, or any radioactive or material that requires special biosafety precautions. Also information about other grants. You have to answer a couple of IP questions. If you want to upload any miscellaneous documents and upload the data management plan, then you have to read and accept the declaration so you can review and submit your proposal. All the information, all the templates and the information related to the call are available on the PPM webpage together with the request for application. And you will also find the template for the research plan. And please make sure that you're using the right updated templates and you are sticking to the formats indicated on the research plan and sticking to the number of pages. So do not exceed 10 pages in total, excluding the cover page, table of contents, and references. And also from this page, you can go to the document library where you'll find the other information, the standard information and guidelines, like on the budget, on the personnel, on the terminal degrees. And you can also access the policies and guidance that would help you to, if you have anything, any question in mind to know while you are developing your proposal. So after the lead principal investigator submits the proposal, it goes to the research office for vetting. So the research office use this step to check if the proposal is aligned with the institution's policies and also with QRDI's policies. Here it's very important, please, to make sure that you prepare your proposal and don't miss the deadline. And don't wait to the last minute to avoid any complications or any issues related to the submission. If you submit earlier, the proposal can be vetted earlier by your research office. The research office can go through the proposal. If there is any recommendation, any suggested modification, they can return it to the lead PI. And in this case, the proposal will be open for modification. So the lead PI can do the necessary updates and modification and has to submit it again to the research office to be vetted. Also, the vetting must be completed in the within the deadline that's indicated in the request for application. And only proposals that are vetted by the research office are considered official submissions to this call. Those vetted proposals would go to the screening, in which we check for the alignment and meeting the eligibility and guidelines of the PPM call, like using the correct templates, fitting to the format of the, for example, research plan template, the supporting letter. Also ensuring that there are no misconduct or that the proposal has not been funded or not being funded by QRDI. Those, by the end of the screening, the outcome of the screening will be sent to the lead PIs and the research office. Those that pass screening will go directly to the evaluation phase. But if the proposal does not pass screening, the lead PI can appeal within a specific time frame. The evaluation of the PPM is two-tier process, peer review and programmatic review. I'll speak about this in a little bit in the coming slide. And by the end of this evaluation, a funding recommendation according to the evaluation is made jointly and agreed jointly by QRDI and QGP, and by the end the awards gets announced. So let us zoom a little bit into the evaluation of the PPM. It's a two-tier process, as I said. The first stage is the peer review of the proposal, in which the proposal are sent to 3 experts in the field, international experts in the field, that they look into certain criteria, mainly focusing on the scientific merit of the project. So they will evaluate the project, give a score for each of these criteria, and write a short narrative. The criteria are scientific excellence, 30% of the peer review score, implementation, 30% of the peer review score, budget, 20%, potential impact, 20%, and they will comment also on the research compliant, but this does not have a score. The top ranking proposals in the peer review will be shortlisted and go to the programmatic review, in which a panel of QGP, together with stakeholders and experts in the field, will review the proposal and evaluate it based on its strategic and programmatic merits, and give a score based on these 2 questions. Relevance to Qatar is 25%, potential impact to Qatar 75%. At the end, the overall score of the proposal will be 40% coming from the peer review and 60% from the programmatic review. Accordingly, the proposals get ranked. A funding recommendation and a joint funding decision will be made by the two joint funders. So before I finish, I'd like to remind you of some important dates. The channel is already open since 7th of March. The submission for the proposal by the lead PI ends on 30 of April. As soon as you submit your proposal, the research office can vet it. So if you submit earlier, there will be more time for vetting. The deadline for vetting is 7th of May. The notification of the screening will be in June this year, and the award announcement will be between October and November this year, aiming to finalize the awarding and notice of the award before the end of this year. So with that, we finish the presentation. We always have the ticketing system. If you have a question at any time, you can send us a ticket on support.qrdi.org.qa. You'll also find it at the bottom of the QRDI portal on Contact Us. As Dr. Hamdi highlighted, please visit Qatar Biobank webpage to know more about their available resources. And if you have any inquiry, you can send it on qbbresearch@qaf.org.qa. That's all, and we'll be happy now to answer any question you have. Please type it for us in the questions and answers box. So first question, please give us the contact info to contact QGB and QBB. And in the request for application, you will have a section about these resources, also together with the links and the emails that you can use to contact QBB, QGB. Hello, will the session recording be available for reference today? Yes, we'll be shortly, early next week, posting the slides of this presentation on the PPM webpage. We have a question here. Can individuals submit proposals with master's degree in other branches, computer science, life science, etc.? So as I mentioned, we have a list of approved terminal degree that's available in the document library. There are a list of the acceptable degrees. It has to be research-oriented doctorate. Check if your degree is available there. If you have any inquiry or it's not listed there, you can send us also a ticket and we will get back to you. But in general, it has to be a terminal degree in research. Is it mandatory to have Qatar Biobank samples? It's not mandatory, but it's highly encouraged. And I think maybe I would also give the floor to Dr. Hamdi, perhaps, or Dr. Saeed, if one of them would like to comment on that. Dr. Saeed.
Yeah, yes, thank you very much, Sadim. It's not mandatory, yes, it's preferred, and it depends on the priority you're applying for, but rest assured that it doesn't really score much, so it wouldn't affect you negatively if you have a very good idea to receive funding or be awarded. But of course, for us, we would love to see more projects utilizing the data and the biological samples.
Thank you so much, Dr. Saeed. So we have another question saying, if there is no registered entity in Qatar, how can researchers participate in this call if private researchers are keen to submit their proposals? So if your institution is not registered, you cannot be, or if the institution you're partnering with is not registered with QRDI, they cannot be submitting institution. That's right. But they can be a collaborative institution, as we said. It has to partner with a submitting institution that has an approved research office. If you want to have a look and know which are the institutions that have a research office, you can go to our QRDI portal, resources, and after that, infrastructure entities, where you can look at under the approved research office to see which institution has an approved research office and can be a submitting institution. There is another question. Previously, private partners, private semi-government are allowed to be PI on the project. Is this discontinued? No, they can be. They can collaborate. They can have PIs. But as I said, they cannot allocate budget for personnel or indirect costs. We have a question on the rebuttal. So in case of resubmission, is the length of the rebuttal section counted in the page limit? No, it's not. So the rebuttal section, if you are resubmitting your proposal, the rebuttal section should not exceed 1.5 pages, but this is not counted in the total number of 10 pages. Can you please share the videos or slides? We'll be posting the slides on the PPM webpage shortly. How many QBB samples have transcriptomics data?
Hamdi?
We do have about 2,000 with transcriptomics data.
Thank you, Dr. Hamdi. Another question also about the data. Would the free of charge data from QBB include also all imaging data, like the MRI?
So we have to check with the QBB. MRI data. This is the first time we will be making available such data. We would have to check with QBB about imaging data.
So we encourage them to contact you to follow up on this this issue.
Yes.
Thank you. A question here: how many PIs can we have per application? There's no certain number to tell you this number or that number. It has to fit with the proposal, for the work packages, with the workload, with the expertise needed and the proposals and the budget as well. And this is actually part of the evaluation, the research team qualification and complementarity. This. What is the total program call budget? So as we said, it's 800,000 Qatari riyal per year for up to 3 years. Can we resubmit a previous ARG grant proposal that was rejected last year to PPM as a new or to resubmission? So this is a good question. If you have submitted to the ARG and the proposal was new in the ARG, you can submit it to the most recent cycle after that cycle. So you can submit it to this PPM 7. Due to technical reason, it has to be flagged as new. But you can write in the comments to QNRF that this has been submitted previously in the ARG and highlight also what has been changed. If you have some comments rebuttal to the previous feedback, also included there. And this can be done only one time. So if it was submitted in the ARG, not awarded, comes to the PPM, it can be done only one time. Here we have a comment: work packages should not be included within the 10-page limit. Could you please exclude them accordingly? They can be submitted as an attachment to the original application. Thank you. Unfortunately, the work packages are counted of the total number of pages, and this is like a standard across all the calls and the programs in QRDI, so it's difficult, it's not possible to exclude them. The fact to put them in the miscellaneous, upload them in a separate section might be risky because the peer reviewers might miss them, and they are a very important part of the review. Could you please let me know if there is a change in the application format from the last cycle? This is related to the resubmission, and was wondering if we can edit the headers and footers only. as I said, please use the updated version from the cycle to avoid missing any section. For the resubmission, you have to fill in the rebuttal section if it's resubmitted, and it should not exceed 1.5 pages. It's not counted to the total number of pages. So please make sure that you're using the updated version of the research plan. How can investigators from outside Qatar apply? Do they have to have partners from inside Qatar? If this is true, how can we find partners from Qatar? So the researchers from outside Qatar cannot be lead principal investigator because, as we said, the lead principal investigator must come from a submitting institution inside Qatar that has an approved research office. So outside Qatar, you cannot be a lead principal investigator, but you can be a principal investigator on a project submitted by a lead PI from inside Qatar. That's possible. How can we find partners?
Yeah, I think here how the question is how to find partners, and I see this question also coming asked by other attendees. So you can search for the QBB portal. There is a project on the with the DPI that are working on this data. You can visit our website, Qatar Genome website, to look at our publications, and you can direct your question directly to us or to QBB, and we can help you in identifying the partner in Qatar.
Thank you, Dr. Hamdi. You can also visit the QRDI portal. Also on the portal, under resources, you'll find entities. So you can also search for entities in Qatar that might be relevant and find. Another option is also search for through the same portal, search for the lead PIs in that area and contact them directly if they are interested. This is another option. Unfortunately, we cannot make the connections. So because this represents like a conflict of interest, so we cannot make the connection. We can direct you where you can go and search, but we cannot tell you collaborate with this person or that person.
They can also have a look at the previous awards, the PPM, the previous cycle, and get an idea about the project. Also, they might be interested in a project that is already ongoing, or so it's also good to have an idea about earlier projects. So they can go to the QRDI portal and then search there.
Yeah, and from the that's very true. And also from there, you can, if you click the project, you can find the individual, find their information, the PIs, and communicate with them. So this is also another suggestion. I think this is done. I am a researcher from Italy working on pharmacokinetics directly relevant to personalized medicine. How can I link with the research groups within Qatar to join a proposal? I think we answered this question. Yeah. Can you please elaborate on the resubmission process? Is the rebuttal letter addressing the reviewer's comment part of the research plan? Yes. So for the if you have submitted in the PPM 6, it was not awarded, you can resubmit here. When you go to the registration section, you can click either new or resubmission. When you click on a resubmission, your previous proposal will appear. You have to select it, and then you start your proposal preparation. The rebuttal section is part of the research plan. You will find it there in the research plan. It's the first or the second page. And here, just remembered, forgot to mention this during my presentation, there is the grant application guide available on our document library, which has all the details related to submitting, registering your proposal, your profile, and preparing your proposal. It's very helpful. I encourage you also to go and check it. Can you please clarify the 3 allowed roles for lead PI or lead PI and PI? So the total count of participation in all PPM cycle from PPM 1 to PPM 7, the total roles allowed are 3 roles. If you have already been awarded or been in an awarded project, 3 projects, in the previous cycles, you don't have extra role to use in this cycle. So the total count is 3. Let's say you got 2 PPMs as a lead PI and PPM 1 and PPM 2, and they are still active. You still have 1 free role to use in PPM 7. This role can be lead PI or a PI. So the total count as a PI or a lead PI are 3 roles. However, for being a lead PI in this cycle, it's only one time. So you can only submit one proposal, but you can be PI on 2 more proposals. I hope this answers your question. Individual from a high education entity that has no previous relationship with the university from Qatar can apply. I'm not quite sure I got the question, but individual proposal from a high education entity that has no previous relation with a university from Qatar can apply. I'm not sure, to be honest, that I got the question, but I'm assuming that you're asking of if it's an entity that's not registered with QRDI, even if it's in Qatar and it's academic, but not registered with QRDI with an approved research office, cannot be a submitting institution. It can be a collaborative institution. I hope this answers the question. If you would like to clarify, you can send us a ticket and we can elaborate more. This is a question to Dr. Hamdi. Does
Yes,
QBB have pediatric samples data?
No, unfortunately, only adult data, 18 years plus.
Okay, thank you. Another question, do you consider funding project not related to genomic or omics data, for example, artificial intelligence and personalized robotic treatment for stroke? I don't know if Dr. Jarrar with us, maybe.
Yeah.
Dr. Jarrar?
Yes, absolutely. Why not? This is exactly what we already mentioned, that AI also. It's a new hot topic of research, and I'm sure it will play a good role in research in precision medicine. So the simple answer is yes.
Thank you, Doctor. If the proposal is successful, when would the grant be released? So we're aiming, if it's awarded, we're aiming to finalize all the award agreements before the end of the year. This is the plan, and accordingly, after that, the awards starts to be released as per the payments schedule that's available in the grant terms and conditions available on the policies webpage. Could a research be a systematic review? Dr. Jarrar?
I doubt that we will have a good evaluation from PRs and the panels, because this is a kind of applied research. And that's why we asked to utilize QPP and QGP data and samples. I doubt it will pass or go through. Thank you.
Thank you, Doctor. If a researcher from other GCC universities submit joint proposal, can researcher be a PI? Yes, if you meet the eligibility criteria for a PI, yes. But then, as we said, again, you have to be collaborating with the lead PI from a submitting institution inside Qatar. How could I identify other researchers who are interested in PPM? I think we have addressed this question either through QBB portal and information listed there, or you'll have information about the PPM, personalized medicine, previous calls. You can also search using keyword and find the awarded projects and communicate with the researchers, or go and check the available entities that are available on our websites. If there is a research team that's relevant, you can communicate with them. How do you budget for private partners? As I said, the private partners cannot be, you should not be budgeting for personnel or indirect costs. The other categories can be filled. given that they are as per the guidelines that we have explained up to the certain percentage that we have presented. There are some redundant questions. Can we submit multiple applications with the same principal investigator, and is there a limit for the number of PIs? So the lead PI, as we said, to be a lead PI, it's only one time per cycle. The lead PI can be a lead PI on a project and PI on another project, that's fine, as long as they are within the 3 role limit across the PPMs. Is there a limit for the other for the number of the PIs? We have addressed this question. So this depends on the proposal, and this is also the size of the research team is also one of the evaluation criteria if it's suitable or not. Dr. Gerard, would you like to add something here?
Sorry, Sadim, what about?
Sorry, I thought you wanted to add something. I'm sorry.
No.
How do we approach the listed entities in this link if we want to collaborate?
I think we already answered this.
Yeah, we answered this.
There's contact details on their website, so they can.
Exactly. What is the percentage of project software and hardware equipment be hard with other collaborator out of Qatar? I'm not sure I got the questions. If you can, so it says what is percentage age of project software, hardware, equipment be shared with other collaborator out of Qatar? Please, if you can just maybe elaborate a little bit so we can address your question. Does QBB have to approve the proposal first before submitting it to PPM? No, that's not the case.
QBB will just tell you if the sample or data required is available or not, and what numbers, if you need the numbers.
Exactly. I'm professor of the University of Calabria, Italy. I am also the co-founder of a company involved in the development of a new generation of smart chemotherapies. We have a shareholder in our company from Doha. We have a drug prototype ready for preclinical and clinical trials. Is there a form of financial support for approval of drug managed by the company? We can include public subjects from Qatar and the share of the company in Italy. I'm not sure if this fits under the PPM scope, but maybe Dr. Gerard, if you can help us in addressing this question.
Thank you, Sadim. Yeah, this is a nice approach, but I would appreciate that this person to contact other researchers from Qatar and discuss with them how they can move on their research for expected trials he's looking for, and how they can utilize their drug and so on. So it's a partnership in further research, basically. So please reach out to other researchers in Qatar or institutions to help you to move forward in this. And I really highly encourage this. It's really good because it's a type of research that's close to the clinical implementation of the bedside. Thank you.
Thank you, Dr. Gerard.
But as I mentioned, I don't want to be specific for certain people and person because I don't want to have a conflict of interest. So just reach out, search, and find out who are the researchers are working with this type of research and with this type of technology, and reach out to them. And I'm sure you will have a positive response. Thank you.
Thank you, Dr. Gerard.
I can take the next question, Sadim.
Yes.
So by QGP samples metadata, how you can get information, I think this was the question. So as I said, you can submit a query on the QBB research portal to get numbers, the information about the data available or metadata available.
Thank you. We have a question about the rebuttal section. So if in the research plan under the rebuttal section, if the proposal is a resubmission, include here the questions and responses to the previous. You mentioned that the whole section is 1.5 pages. Now it's this is not mentioned in the template. And what if the reviewers' questions that need to be included are long themselves? I hope this is clear. In the updated template, it's mentioned that the rebuttal section should not exceed 1.5 pages. So the thing is, you have to summarize and fit in the essence of the response to the question within this 1.5 page.
I have to go, Sadim, sorry.
Okay, thank you, doctor. The registering for PPM 7 project and Q grant is next Sunday. If we missed it, can still be submitted or not. The registration for the deadline for registration is on the 30th of April. Not the registration, the submission of the proposal is the 30th of April as a lead PI. The registration is opened all the time. Anytime you can register as a researcher. To register and submit your proposal, the deadline is 30th of April and the vetting is 7th of May. If you miss these days, no, unfortunately, even if you start preparing your proposal and you didn't vet it by the deadline, unfortunately, it cannot be accepted as indicated. Sorry, we're having so many questions. I'll try to take 2 more before we finish. So if a researcher was a lead PI in a previous cycle, he can be a lead PI again in the cycle, yes, as long as he didn't exceed the 3 roles number. Could one be lead PI in PPM and lead PI in ARG? Yes, they are not linked to each other, and also the total number of roles is not linked to the ARG. I think we have time with one more question.
I think you have answered the remaining questions. We already mentioned this.
Okay, the emphasis on the implementation. Yeah, how do you budget?
Can have a look at the previous project.
Yeah, much as that one present maybe trying. So let me take just one, Dr. Hamdi. This is the last one. I don't know if this has been answered before or not. The call seems to put high emphasis on the aspects of implementation. This side is important, but might be interpreted in different ways. Could you elaborate on this with some general examples with previous cycles?
Yeah, exactly. So you can visit the QRDI website and search in the previous cycles, and you would get an idea about what kind of implementation. But it's as we said in the presentation, we are looking for a project that.
I think you're muted, Dr. Hamdi.
So yes, implementation is using QGP resources to come up with a project, innovative project that could help in the for the patient care for the different thematic that we mentioned. So I really encourage the researcher to look at the previous project, and if he has still a question, he can ask us.
Thank you so much. Thank you so much, Dr. Hamdi. I think now we came to the end of our information session. We still have some questions, but unfortunately, there's no time. I think we answered most of them. The remaining might be redundant, but we apologize if we cannot answer all of your questions. But we have the supporting system. You can send a ticket at any time, and we'll get back to you as soon as possible. Thank you so much. I want to thank Dr. Hamdi, Dr. Saeed, Dr. Jarrar, for being with us today, for the useful input to this information session. And I wish everybody the best in applying for the PPM call. Dr. Hamdi, do you want to say something before we finish?
Thank you very much, Salim. Thank you.
Thank you so much.
All
Thank
the
you,
best
everyone.
for all the applicants.
All the best. Thank you
Good
so
luck.
much. Good luck.
Bye.
Thank you. Bye-bye.